Welcome everyone to Digital Health and My Health Record, webinar 4 in our series. I am Katrina Otto from Train IT Medical, and this webinar is brought to you by Allied Health Professions Australia, AHPA. It is the 4th in the series, and this webinar series have all been recorded, as tonight's will be, and will be available for you to view from ahpa.com.au and also my website trainitmedical.com.au. We are also creating resources regularly, and we are putting them on those sites for you also. Tonight's focus is going to be on digital health, and in particular the My Health Record system. I'm going to be talking about the changes that are coming next year, the expansion program. So it's very exciting. There's a lot happening in this space, and I might have to talk quite quickly to cover everything tonight. But I'm really very excited because it is really important that allied health professionals are connected to Australia's My Health Record system. You play such an important part in the patient's healthcare journey, and communicating electronically, streamlining that communication, you being able to view discharge summaries, shared health summaries and results is what I want to talk about tonight. Looking at that summary information via clinical software, or if not, via the provider portal. And I'll look at how you actually can upload event summaries if you do have clinical software, and e-referrals, so that we do streamline that communication. Now, for those who are attending the webinar of the series for the first time tonight, we have run 3 previous webinars, and we started with clinical software. As I said, those webinars are recorded, available for you to view, and AHPA has also kindly managed and created the software spreadsheet, which will tell you what connectivity stage the software providers are at. So I'll talk a little bit more about that later, but right now I just wanted to start with what is My Health Record. I don't like to assume people come to webinars or education ever knowing everything. So what I tend to do is include a lot of information in this presentation. You know you have this presentation, you can download it, refer to it, and it's full of links. And if you're wanting to know more about a feature that I talk about, you can click on the link, and then you can read more about that and find the right site to move forward with that aspect. So My Health Record is for our patients. It is an electronic summary of the patient's health information that can be shared securely online. I have been working in medical practices for 27 years myself, many of those as a practice manager, and I am often saying we share a lot of this information regularly. We just don't necessarily do it very efficiently. We fax it and we chase it, or we go without it. So tonight is about improving our communication, and this is the future, and it is also a significant safety issue. Communication, effective communication, and having that timely communication. So the Australian Digital Health Agency, I will talk a lot about tonight and be referring to their website constantly. They did create a national digital health strategy, a huge consultation process. It is very clear that Australians do want this. It is the future, and people are wanting to access their own health information. I am not even young, and I have my health information, my health record, accessible on my iPad anytime, anywhere in the world. I also have my children's connected. I also have my elderly parents because I'm a representative for them. So it is something that is going to be very much part of our future practice. So the more we understand, the more we get on board, benefit both our patients and our practices. As of next year, 2018, every Australian will be offered a My Health Record. So if you don't already have one, a new record will be created for you, and I'll talk about what that looks like tonight. So as I said, I have a My Health Record. I went online and I created one about when it first came out nearly 5 years ago, and it's a process that takes a little bit of time, and for a lot of people it's not been a priority. It's something that has now been decided we don't need to do. It will be created for you. General practice does still register patients, and that's really important because we need more patients with a My Health record than currently have one. So when we talk about a My Health record, it is for the patient. The patient is the center of their own healthcare and needing their own information. But it's also absolutely vital that all the healthcare providers who are helping that patient do have access and can view and upload. So you do need to be a healthcare provider who is providing healthcare for the patient to view and upload to that patient's My Health record. And the sort of documents that you would be talking about here would be, if we look at allied health here for a moment, significantly, you'll be able to access discharge summaries. You will also be able to access shared health summaries and, of course, any of these documents. But those, from my travels, those two documents in particular, I hear constantly from allied health professionals would be so beneficial to their care. Generally speaking, we talk in terms of, the general practice. A GP is looking after that patient's health. They are curating their health summary. So they would upload a shared health summary, and that's a regular process now. So a shared health summary having allergies, medications, significant medical history, and immunizations. So the regular GP has that. It should be up to date. That's part of the standards of care, and they upload. That's then available, of course, hospital, but also now for you. So from an allied health perspective, we usually talk about the benefit of you uploading an event summary. I'll talk about Brooke, the OT, again tonight because I've been stalking her. She calls it an event summary plan, because she also uses it as a plan to communicate with others. Discharge summaries uploaded by the hospitals, and that's happening more and more. Specialist letters, most specialist letters seem to be coming from St. Vincent's Hospital, the Northern Territory at the moment. And most excitingly, we have two recent advances in that we have pathology and radiology now connecting to the system, and we have a new view. We've always had prescription and dispense information, which of course is so important, but now we have a new view which enables it to be even easier to see a patient's medication. So that's popular, and I'll show you a screenshot of that later. So e-referrals I will touch on tonight. It is not one that's taken off yet. The focus has been on shared health summaries and discharge summaries, and as I said, now a focus on pathology and radiology and a new view. But I will definitely show you e-referrals tonight. So these two websites, these are our go-to websites. These are so full of information, training, resources. It's also where myhealthrecord.gov.au is where I access these latest statistics, so you can always go back and get the more up-to-date ones. Just a little bit of a snapshot of where we're at with Australia, because this is Australia's online summary health information. It is built, it works. We are now starting to upload more information, as you can see here, and discharge summaries being the most common document, followed by shared health summaries. So we have 309,223 event summaries, and I'm hoping after tonight there'll be quite a few more. So it is general practices, as you can see on this list here, every aspect of healthcare that is being coordinated here in order for you to be able to communicate for and about your patients. Most of our patients are aged 20 or less. It's a bit of a no-brainer these days about electronic communication. I always laugh when I think about a young parent being given a book versus an app, and I'm sure I know which one they would choose. So when it comes to allied health, of course, that's our focus tonight. What's in it for you and your patients? This, again, the links are here. You can download this, read more at your leisure. But you can see here the discharge summaries, shared health summaries, MBS, PBS, prescription information, quickly gaining a picture of health information you may not have received directly. I have case studies for you to read about. There's exercise physiology, and I will also go back. If you haven't attended our other webinars, I have in the last webinar also featured a case study of Brooke, occupational therapist, who after 27 years of handwriting notes was handed a laptop and said she wasn't allowed to handwrite notes anymore in the rehab facility. So I told that story in the last webinar. All that information is there. In this one, there is a video here of Brooke uploading an event summary with her patient. She talks a lot. She uses the word timely a lot. It's very important in a rehab environment. I got that feeling exactly. It's so important that she has timely access to relevant information and does say it's a patient safety issue. So you could watch that if that's of interest to you. She talks about she needs to share her event summary with physiotherapists, dietitians, speeches, consultant psychologist, and of course the GP. And she needs to know, she said, if the doctor says they're weight bearing, non-weight bearing, this timely information is so important. So you may receive that information already directly, the information you need to do your job. However, what we're talking about with My Health Record is often about accessing information you didn't receive. So a discharge summary is a great example, except for the GP who is regularly providing care for the patient. Nobody else usually gets the discharge summary. So now it's about improving access to that information. So you can access a patient's discharge summary, as can another hospital or another healthcare provider, after hours care, for example, who happens to see that patient. So when you do access that document, if you have conformance software, you can simply save it as well. So from my practice management experience, I always say it's a confidentiality improvement, because right now the reality is we would get that faxed and then somebody would need to scan it in. So not only are you paying somebody to scan it in, but somebody has to look at that and say, who is it for? What's it called? Where will I put it? And then invariably, oh, I know them. So I always argue we're not doing everything we can to protect privacy. We have technology, but how do we get started? So this is digitalhealth.gov.au. So this is the key website to go to get started. And right here on that site, apply for digital health online. So over the 5 years, I believe it has become a lot easier to get connected. But I do remind everyone that this is bank strength security. This is the highest level of security that there is. So it can't be a 2-second process and through your computer you can access everybody's My Health record. So there is a process that you need to go through. And I'll talk a little bit later tonight about perhaps your primary health network. Every area has a primary health network. Perhaps that's some option that you could reach out to them and they may be able to even help you with the process if you are quite new to computers, or you really time poor, which I know a lot of you probably are saying yes, of course. So please know that the digitalhealth.gov.au, the online forms, is a place where you start. And I'm also going to just point to this section here, because this is one of my favorite places as a trainer. This is what we call the sandpit, where you can just go and play. It's a test patient. You can go and play. There are training resources here on a variety of conformance software products. You can access the list of conformance software products. There is so much information on this site and so much learning. There are allied health case studies. a lot of information for pharmacy, should there be pharmacists watching in tonight as well. So that's the place to get started. And I often feel I'll just quickly talk to this quite old slide now because I still find it helps put the My Health Record system in perspective if we go back to the actual foundations of it. So many years ago, the day Julia Gillard kicked out Kevin Rudd, that day, every Australian was given a new number, an individual healthcare identifier. They do not need to know what it is because the software will pull it in once everything is connected correctly. And by that, I mean conformance software, and then a organizational number called a HPIO, so where the service was provided, and a clinician number called a HPII. So essentially, who received the service, where was it provided, and who provided it, and then what was the event that happened. Now, the good thing for you all is no matter where you work, if you work at multiple facilities, you have the same HPII, not like provider numbers. So when you go to a new place of employment, you would give them your HPII and they would attach it to their HPIO. So what that means is the software will pull in the patient number, and when you're communicating, that's how we know who it's about. So this little flowchart here, in case it helps, I thought this might help. So you register your organisation and you obtain a HPIO. You can use those online forms through digitalhealth.gov. You will receive a NASH PKI certificate to be loaded. Also, ask AHPA. Contact AHPA or look on your registration, look for your HPII. Then the big question is, do you have digital health conformance software? So if you are using any of the, and I know a lot of you are from the registration, the major, software, best practice, medical director, Genie, ZMed, they are all conformant. If you have digital health conformance software, then you use that and it's very, very easy. If you don't, you can still access the patient's My Health record via the provider portal, but you can't upload. And we really want you to be uploading and sharing your important health information, of course, as well. So I've just got a couple of screenshots here about what it looks like when you are accessing via conformance software. And this is best practice. And this has been around since 2012. And as you can imagine, over that time, the clinicians that are using it, they're wonderful. They give feedback, what they like, what they don't like. Straight away, they said, don't make us go clicking on something to find that the patient doesn't have a My Health record. Because remember, there's only going to be about 24% maximum of your patients. 24 to 28% now, I'm standing corrected, of your patients who have a My Health record at the moment. And that was helped with 1 million people in the trial zones, which was Far North Queensland and Nepean Blue Mountains. So it's not a great deal of likelihood that you're going to see a lot of patients with a My Health record. So the software makes it green to let you know straight away. Now, the My Health record expansion program that will take place next year, where every Australian will be offered a My Health record, going by the experiences of the trials. Approximately 2% of people opted out. So therefore, by the end of next year, you should have 98% possibly of your patients who have a My Health record. And I was the trainer involved. I trained for the Australian Digital Health Agency at times, and I even think that there'll be some of the people who opted out opt back in because they did not understand. So one of the lessons that we've learnt from that experience is that there is a lot of education that's needed with this. Patients will need education, and of course supporting the clinicians, which is what we're doing now and what the PHNs are doing for you also. And of course your wonderful associations. So all working together, by the end of next year, we'll have most Australians with a My Health record. And then what we need to do is start uploading more information so it becomes more and more helpful to the clinicians who are caring for them. So from a access perspective, one of the improvements, make it green. So I always say to the doctor, so if I'm waffling on about, I take tablets and they're round and white, go, oh, I hope she's got a My Health record and I hope her GP's uploaded a summary. And you can click on that. To upload, you would click on the My Health record. So that's best practice. In Medical Director, they're all very similar. They're very easy to use. Using the My Health record is not the problem. It's first of all understanding it, then getting connected, and the change process, embedding it into your workflow. But actually using it is very easy, and it needs to be. So My Health record, they have a My Health record, and then you would access it. So that's Medical Director. And then once you access it, as you can see, there's a list of some of those documents that we were talking about, such as discharge summaries, event summaries, shared health summaries. And if you imagine, babies are pretty much born with a My Health record these days, and it's a whole of life summary health information. It's going to be a lot of information on here. So these filters, that was another improvement suggestion by the clinicians using the system. Having filters so that you can quickly find information that you're looking for. Remembering also that patients can access their own information. I actually accessed my son's My Health record and generated an immunisation summary for a high school application form rather than going back to my practice. So that is something that is a major change for a lot of general practice, the fact that patients will see their own health information. And talking about getting used to changes, the on-demand training environment this is fantastic. I call it the sandpit because you can go here and you can log on to best practice, Communicare, any of these ones you see here, and you can just have a practice with how it works. It is also helpful to know that there are videos to show you how they work. There are cheat sheets, guides, e-learning modules. And I think also importantly, we can look at the consumer portal. Now, I've talked about the fact that I have a My Health record, got my family on there. I feel like I can, have access and manage health information. I even uploaded an advanced care directive recently for my elderly parents. If you don't want to create your own right at this moment, it's really still important working in health that we understand how it all works. You can log on to the consumer portal through here and you can actually have a look at what it looks like from a consumer perspective. There is privacy settings that we need to know about, and I've included a whole lot of information, further information and reading on all the common areas, the questions I get asked, the privacy topics as well in this presentation tonight. So again, these are the documents that we will be talking about, including an event summary, which would be a common document for allied health to upload, an event summary. So the other things that you would be able to see include, I alluded to before, a new medicines preview. So I might just quickly flick over to that on-demand training environment. So this is digitalhealth.gov.au. I'm always hesitant because with 300 people connected and the bandwidth, I'm never trusting that it's going to hold, but it will be clear in the recording for you if we can't do it live tonight. But this is the on-demand training environment, all the resources. But I do want to show you that there is the consumer portal, there's guides, it tells you what the passwords are, and you can go and have a play. So from a practice perspective, this has kind of become like the orientation process, part of the IT orientation these days. So if I was to go, I'll go to medical director as an example. What usually happens is it comes up and allows you to see a list of guides, cheat sheets on the right hand side, and it tells you the patient's name, and it allows you to log on to this dummy software world where you have a patient. If it comes up on the right hand side, the patient's name is Caleb Darrington, and the password it tells you on there as well. Password is a weird variation of the word password, W0RD. So yeah, so that is over here. There it is. So the password is password there, and the patient's name is Caleb Darrington. Okay. So this is just about to be updated. It still says PCHR, which is the old name for My Health Record. And so if I click on the PCHR drop down, I can access the patient's My Health Record. So on there, you're, as we said, looking for things like discharge summaries, and these are the filters that I was talking about tonight. Now, I'm not going to spend too long going over these particular nuances because that's software specific. But as I said, it's going to be important to have filters. Imagine even 1 week hospital stay with all the tests that you could have done. So we'll need to filter out, and here's a list of what you could possibly be looking for in the My Health Record. The wonderful thing about this is, say you did not get this discharge summary, you can read that discharge summary, and then they had a fall at home, and then you can save it straight into your software and move on with the consultation. As you're creating your notes today and whatever you're writing, then it becomes part of following discharge from fall, etc., etc., etc. I won't go into that too much. Have a look at the webinar on clinical note taking that we did to learn more about that. But when you have saved that document, it would save into your software and you can access it again there. It also, hopefully in the software, will put a note to say that you've done that. So on that My Health Record, we can access discharge summaries, shared health summaries, as you saw, but we also now have this new medicines view. So this is straight from the Australian Digital Health Agency slide pack. It's brand new. It's very important that we have access to the most recent information about the patient, and that's what this does. It pulls in the most recent allergies, shared health summary, discharge summary, and medicines. And then we can go there and we can navigate between them. Now, I've just also included in here a link to, a view of Whiteboard. Now, we've talked about accessing through our software, accessing through the clinical software and clicking on the PCH My Health Record. I'm going to talk in a moment about if you don't have conformance software, I know a lot of you don't, then there are also intermediate options, and Whiteboard would be one of those, allowing the connection without being a full clinical software system. And then we'll go to the third level, which is the provider portal. So I'll go there in just a moment. But while I'm in the patient record, I just wanted to skip ahead for 1 second. I just want to show you how quick and easy it is to upload should you have conformance software. So again, this is one. They're all very similar with features, or they should be. They should be offering a lot of helpful and similar features. But in Medical Director, I'm just going to create a letter. And we did this in a previous webinar. So if I'm going a little bit fast, know that you can go back and view that webinar. I'm going to create a new document, and there is a tab called eHealth. So within Medical Director, these are the 4 different documents that I could access. If I was using Medical Director in a specialist practice, then I would probably want to access the specialist letter. General practitioners, as we said, often use the shared health summary. And from an allied health perspective, the event summary. Now, the event summary, in my belief, is better. It's a great document because it allows you to really put your plan in there. So if you have collected notes today, it's going to give you the option to put those notes in there. Now, I'm just going to flick to my own version of Medical Director for a moment, and I just want to show you. You'll go to a letter, you'll go to eHealth, you'll go to an event summary. I'll import my progress note from today, which I haven't done one. And then we can also include any other information such as allergies, medications, should you have collected it. Or you can write your synopsis, your plans in here and hit the My Health record to upload. So it is very, very straightforward to upload. I'll go into the test environment again. The only difference in this older version is it doesn't have an import clinical notes and the tick boxes, which again just shows a great improvement that's recently been made. And I just read today that this is going to be updated, I think, in the next very short while. So upload, it puts it into that CDA format, and then down the bottom right it says send. So literally, if you did about 10, you'd be very well familiar with it. There's a cheat sheet that we created step by step, but it's about what software you have. So what we need now is we need all the software providers to be connected. So that's, I've told them. So please tell them yourselves. I know from working with the software vendors that they're always saying to me, our customers haven't asked for that. And so I'm saying, if you want something, please let them know. So if you do not have conformance software, maybe you don't have any software, you can still participate. And that would be through the provider portal. So I'm just going to quickly go to another site now, and I'm going to go to myhealthrecord.gov.au. So this is the other main site I was telling you about. So you could even create your own My Health Record right now if you wanted to, or if you had one, that's where you could sign in. I like doing it for the app though, it's so much easier. More information you can access here, and for healthcare providers. So connecting, okay, that's your starting point. Training, whole e-learning module, logging on to the provider portal. So when you do log on to that provider portal, it'll say to you, you need to have your valid NASH token to connect. So when you've gone through that process of getting your information, your NASH token, your HPII, this is what it's going to look like when you can access the provider portal for a patient. And now we have under that drop-down menu, medicine records. So this is the new look. We've got the health record overview, the clinical documents, and consumers can add their own documents as well with limitations. So even from a care planning perspective, being able to see MBS item numbers is helpful. Being able to see who the patient previously saw. It's all about streamlining that communication. So medicine information, and of course we have all the other documents that we've referred to before, but the medicines information has just been greatly enhanced. So the National Provider Portal for viewing, if you don't have conformance software, if you have conformance software, it's about now starting to upload information. And I've just put a table here, the difference between a shared health summary and an event summary. But from an allied health perspective, I imagine you would be uploading event summaries. So it's about when you are communicating with other healthcare providers and you're communicating to them, but also with the patient. So it doesn't replace your direct communication. If you wish to contact or send information to another clinician, you do that, and that's secure messaging. However, this means that your patient and the next clinician who sees them can access information they may not have received in a timely manner, especially. So an event summary can be uploaded by any healthcare provider. I cannot upload anything. I am not a healthcare provider. You need to be a healthcare provider with a HPII working at a participating organisation, and you need to be providing healthcare for that patient. So you have consent. You need to you need to be providing healthcare for the patient in order to have that consent. And I've got more information about consent in this slide deck as well. So I did include some screenshots for you as well, again, so you could see how easy it is to upload an event summary. The idea is your notes are created in your progress notes of your software. Uploading the summary merely pulls those notes in, and then you tweak out what you don't want and add any extra you do. So there's a video. You can watch it later if you like, how to upload. And the idea being you review that patient record. You document that event, you would be doing that, and you in your software follow those steps. Review it with your patient, send the event summary. And this process is really, really well, I think, done by Brooke, the OT, in the video. So I would encourage you to watch that, because Brooke discusses an event summary with the patient and does it beautifully. So anybody who says to me that a computer detracts from the connection with a patient, I would be showing them that video, because you can do it really well. So how do you upload? This is best practice. You would click on My Health Record. We saw it in Medical Director. Now, I am not going to play this now because I could possibly lose everybody, and I'm not taking that risk. But know that you can watch that. It's on my website. I've put a whole lot of videos as I followed Brooke around, and I interviewed her as well. She talks about using that, and she talks about the team. She does assessments, and then the team comes in after. So providing really good handover information, absolutely vital. So when it comes to event summaries and e-referrals, we saw 309,000 event summaries. Have a look at e-referrals. E-referrals kind of makes me laugh, because in my software training world, it's a great idea. Don't get me wrong. Fabulous idea to have the one document. So I'll go back to Medical Director. I'll go to Letters and eHealth, and I'll grab an e-referral. So it's a fabulous idea. We've got one document, and we can use this as a referral. But I don't know about you, but I find everybody wants their own referral. I have trouble within one practice getting everyone to use the one referral, let alone within the one country. So the concept of that e-referral is great. I hope it does take off. It's that standard format, that CDA format. And I do find that format, clinicians like it. You get used to seeing the important information, unlike some of our referrals where you can't see the wood for the trees. So it also uses the healthcare provider directory to identify allied health providers and specialists. And in the last webinar, I encouraged you all to add your names to the healthcare provider directory. And as I mentioned before, it's that timely communication. So we're not chasing, we're not, they're not lost. You have it instantly because it is electronically sent. So saving time for your practice, confidentiality, and you know it's been delivered. So an e-referral is, if I go back into here, is a little bit slower to take off because of those reasons I stated, and also because not all the software even has an e-referral yet. So medical director does, best practice doesn't, and as I mentioned before, with a lot of the allied health software products, we're starting to just talk about getting connected. So we often say digital health is a marathon, not a sprint. But it's working, it's built, and it's about continual progress. So the e-referrals, they work. They're there. You can send e-referrals, and once you have your secure messaging set up, then you have the options to be able to send via secure messaging, and also so you can send via secure messaging, but also send a copy to the patient's My Health record. So it is a new era. Patients will see their own information. They do want this. Without doubt, patients want access to their own health information. They want apps. They want to communicate with you. They want to be involved. Really not every single patient, but it's definitely shown that if we don't use this national system, patients may find a way around it. And you hear that often. You hear about people with USBs and people carrying manila folders around with them. So we can do better than that. This system is built for our country. It's now about making it meaningful for you so it's clinically beneficial. So when we talk about apps, I have this one, Healthy. It's free. It connects to the My Health record system. So I would encourage everybody, if you're looking at apps, to make sure that they are authorized by the Australian Digital Health Agency. There's a lot of, development at the moment. So we need to be sure. I would always be extremely hesitant if anybody wanted to connect anything to my practice software. So the idea is this doesn't connect to your practice software. This connects to your My Health record. Your clinical software uploads to the patient's My Health record. So the patient is connecting to their own My Health record. And these are the approved ones. So as I said, by accessing information via the app, patients can see the event summaries you uploaded. So this is possibly a way to incorporate more engagement in the treatment and the plans that you have, the information that you're giving them as well. So lastly, I just wanted to include a little bit here on consent. I get asked a lot of questions about privacy and consent. So I always say it is important to communicate with patients what you're doing and why. If you watch the video of how Brooke does this, it's fantastic. It's really including the patient in the conversation. Practice management perspective again, don't want any surprises, don't want the patient to be surprised, don't want any complaints because I didn't know what you were doing and why. So it's really important to be clear. You do not need individual consent each time you upload. If you are providing care, healthcare for the patient, you have consent. However, it is a courtesy, I believe, to discuss with patients what we're doing and why. And the AMA has a guide also. So there's some more information you can access. The Australian Digital Health Agency has a helpline and ways to not only contact them for help, but you can also click here to submit education and training requests, should that be something that you would be interested in. The other education and training and assistance that you may be able to access is through your local primary health network. Now, I love the primary health networks. I work with all of them, and some of them have been saying to me, Katrina, we really want to be able to help the allied health professionals. I obviously can't give any information out, but what I can do is, if anybody attending tonight wishes to contact me regarding connecting with your primary health network, I will be happy to pass on that request to them. So it is obviously a huge goal to be able to ensure that digital health is not just about hospitals and GPs. It is allied health professionals. It is all healthcare providers. So please know that that's another option. You can go and find your local PHN and contact them, or you could send me a request and I will pass it on. Just in case that's not quite enough information for you, I also created this whole page of extra learning resources. So these are the ones that I felt were most helpful and most relevant for you. Those privacy FAQs are really good. I would say, these days, you can imagine in the last 4 years, I've done hundreds and hundreds of my health record presentations. And as soon as somebody says to me that they're worried that somebody might access their My Health record, I say straight away, you can set controls on it to the point where you need to give the clinician a PIN number to be able to see it. So that is the level of access and privacy that patients can access. If they were unconscious or outside their usual mind, there is a break glass emergency kind of facility and the patient would be notified. I have mine set so that if a new practice accesses it, I just get an SMS alert that tells me that. So there are questions that you will have as you go along this journey. I've included my top 50 questions that doctors have asked me over the last 4 years, and also the way that I respond to those questions. So it is really important, that you have the opportunity to have your questions answered. Know there is a whole lot of information available through these links that I've given you tonight. There's brochures. There is the sandpit to practice in. So I'll finish up. I thank you all for attending. I appreciate it's the end of a day for you, and I am keen to further connect with you and help on the digital health journey. So thank you, everybody. This recording will be available on my website, this link, Train IT Medical, and it will be available by tomorrow night. Thank you and good night.